everyone. Thank you so much for joining. My name is Caroline. I'm on the marketing team here at Adonis, and I'm really excited to moderate today's webinar, Inside RCM, a 2026 research briefing on payer pressure, visibility gaps, and revenue risk. So this research is from a survey we ran earlier this year. We had responses from over 120 RCM leaders across 18 different specialties. We'll be sending out the full report right after this session, along with the recording of today's webinar. So if there's anything you want to dive into a little deeper, you'll have access to all of that. And then the last housekeeping item for today is there is a questions window in the webinar channel. So feel free to drop any questions that come up in that chat. And if we have time at the end, we'll address those. If not, we'll be sure to follow up afterwards with any questions. So really excited to introduce our speakers. Again, my name is Caroline. I'm the Director of Content and Brand Marketing here at Adonis, and I'm joined today by Casey and Michelle. I'd love to pass it over to you guys if you could introduce yourself. I'd love to hear a little bit about your background and the work that you do with RCM teams here at Adonis.
Great. I'm happy to kick things off. My name is Casey Lilly. I'm a senior account executive on the partnerships team here at Adonis. So I primarily work with physician groups across the country that are exploring different AI solutions to enhance their revenue cycle from a top line performance standpoint and also from an automation perspective. A lot of those conversations give me a vantage point into how folks are viewing the rev cycle overall, their interactions with payers, their perception of the market, and the different challenges that they face. I have been with Adonis for a little over a year, but I've been in the revenue cycle space for the past 10 years, spending some time at Flatiron Health and at ABW Medical on the rev cycle services sort of side of things. And then prior to that, working in utilization and quality consulting at the advisory board.
Thanks, Casey. Hi, everybody. My name is Michelle Kadra-Masumba. I am also a member of the partnerships team here at Adonis. My role is Director of Solution Design. I have been with Adonis now for going on 2 years. Prior to joining Adonis, I spent 17 years with Athena Health and spent about 5 years with Flatiron focused on revenue cycle for oncology. The role of our team here, the solution design team, is to ensure we are outfitting our clients with the appropriate solution and to establish the anticipated impact that our solutions, our Adonis solutions, will have on their revenue, on their staffing, and even on their tech stack. So really excited to be here today and talk through the results of the survey.
Wonderful. Thank you both. We're so excited to have you guys. So thank you for taking a little bit of time out of your day to chat with us. So for everyone on the line, the way we've kind of broken up today's research is we have 3 core headline findings. We have some stats that back up those findings, and then we're going to ask Casey and Michelle if that kind of reflects the conversations they're having and what they're seeing in the market. So the first headline finding here is payer pressure is the primary driver of revenue risk. Probably no surprise here, but we asked in 2025 what were the top 3 factors that impacted the organization's ability to grow and collect revenue. And then we also asked teams to predict what top 3 factors they view to be the biggest obstacles to revenue growth in 2026. So you can see in 2025, frequent changes to payer adjudication rules, denial volume and complexity, and payer reimbursement levels and contract terms were the 3 biggest factors impacting revenue. And in 2026, teams are predicting denial and underpayment management, payer reimbursement pressure, and staffing constraints to be the biggest challenges that they foresee for the upcoming year. So Michelle and Casey would love to open it up with the 2 of you have been going to a ton of conferences over the past year. You guys have been flying all over the country, meeting with different RCM teams. Does this align with what you guys are seeing? Are these the challenges that you feel like people are most stressed about right now?
Yeah, the easy answer is yes. And obviously for folks joining this webinar, I assume there's a level of rev cycle expertise among all the participants. And so payers sort of being the primary driver of your revenue leakage and your stress is not really a shock to anyone who's in this space. Some years ago, maybe during the pandemic and sort of in the years immediately after that, maybe staffing was the primary sort of worry of folks leading revenue cycle teams. But really, the trend has been moving in the direction for a very long time of payers really just applying additional pressure and finding new and novel and, to their credit, very creative ways to make it harder for you to get paid on time and in full. Michelle, having worked at Athena Health, you'll be familiar with, the rev cycle of call it 5 to 10 years ago, where you could maybe via an Athena Health or an Epic or your practice management systems in sort of a rule-based and like claim scrubbing capacity, maybe get ahead of and model out like what your payer expectations were going to be. Not that there wouldn't be challenges downstream of that. But we're really in this new world now where even with sort of the tightest sort of claim scrubbing and filtering processes on the front end, payers come up with a lot of unique ways to avoid paying you, and you usually find out about those retroactively when you're sitting on a mountain of denials, or you realize you've been underpaid at scale, or you're having to work 3 times as hard to appeal a downcoded claim for an E&M code that would have been paid in 8 days with no problem 2 years ago. So the flavor of these payer pressures look a little bit differently depending on the size of the organization we're working with, the platform they're on, their payer market. But the general theme is the payer challenge.
Yeah, Caroline, I don't even like it's interesting because we're at a point, to Casey's point, we're at a point where it's not even realistic to think that we can create a rules engine or purchase a scrubber that can keep pace with the rate of change that payers are introducing into the adjudication logic on a day-to-day basis. We are seeing our clients struggling with both denials from net new payer edits that are being introduced and that are changing on a month-to-month basis. And in addition to that, they're now struggling with trying to keep pace with the number of claims that are being paid incorrectly. And it could be that the claim was paid incorrectly and or that the claim was downcoded. So um, it's as if denials were certainly enough to try and keep up with. Now we have denials, we have downcoded claims, and we have underpaid claims that we're seeing all of our business office members really struggling with.
Yeah,
The other, I
definitely.
think,
Oh, go ahead, Casey.
No, I was going to say the other thing I would call out too is, underpayments and downcoding, right? There's a level of frustration there because in a lot of cases, you don't even know that that's happening, or it's harder to sort of unearth that. Denials, you could say maybe used to be more straightforward. At least you knew why you weren't getting this revenue. But Michelle, to your point, like these new claim adjudication rules and logic that's being employed by the payers, what I see kind of firsthand, any potential partner to Adonis that we work with, we try to take a look at current state performance. That's largely what Michelle's team does. And you look at sort of the frequent denial trends, and it doesn't matter like what state, what market, what payer you're looking at. The top denial reason for everybody is CO16, which is basically missing or invalid information, which tells you almost nothing. And so every single one of those claims, even though they're giving you a denial reason, you're going to spend some level of like manual time and effort to figure out like what the payer even wants for you to be able to file an appeal and have a successful resubmission. So even the straightforward stuff isn't straightforward before you even get into like the complexity around underpayments and downcoding.
Yeah, even the straightforward, you're absolutely right. Like it's just not straightforward. And trying to staff for that, trying to find the individuals that you can train to evaluate payer policy, to evaluate the claim, the manner in which a claim was adjudicated, how it was priced is getting more and more difficult. And really just such a manual, tedious process on a good day, trying to find the systems to do it, very, very difficult. So yeah, no, 100% Casey.
Yeah, and the teams piece too, that sort of ties into staffing constraints a little bit. We have some folks here at Adonis, and I have some kind of view into like the health system space. And at the health system level, those are organizations that are able to have teams of revenue integrity analysts and entire managed contracting departments that are really there to like get in the weeds of one, just like building out and designing these contracts, and then enforcing them and holding payers accountable to them. When you go to, and I say small, all things relative, like when you go to any kind of physician or ambulatory group space, it's very, very difficult, sort of in like the margins those groups are operating with, to have the luxury of even one revenue integrity analyst or one contracting expert. And so you're sort of asking your rev cycle leader, whether it's a VP, director, sometimes billing managers, to not only like manage the day-to-day complexity of claims in and out and the teams that support that, but also like having the time and the space to zoom out and do this like deep analytical investigative work. And the current state tools that folks have, practice management systems, Tableau, Power BI, things like that, they're not designed to do that efficiently and to really like help you speed up that process. So it's a challenge for everyone, but I'll like make a special shout out that when you're working on a little bit of like a leaner staffing model and you don't have the luxury of those sort of cross-functional collaborative roles at like a health system level, you really are sort of like flying blind and just trying to sort of duct tape a solution together most weeks.
Yeah, and I'd love to hear from the folks on the line as well. Like I mentioned, if we have time at the end, we'll dive into questions. But if anyone has any comments of how they're kind of thinking about this or if this resonates with them, definitely feel free to jump in. We'd love to hear from you guys as well. But let's
Yeah.
jump. Oh, go ahead, Michelle. Did you have
Oh,
something?
I was going to say, Caroline, before we jump away from that slide, the one other item called out here in this first finding that I think is really interesting on the left-hand side, you mentioned keeping up with the AR backlog. I think this is another opportunity, another area that people are struggling with is how much time and how much of their resource allocation they can attribute to keeping up with those claims that are just simply aging out. We're finding that claims might get responded to once, the provider will respond in kind, and then they hear nothing back from the payer. That addition, that ability to follow up on that aged AR and keep pace with all of those, the multiple submissions of those claims, the multiple requests for additional information for those claims, and really it is something that we are hearing over and over again when we walk into to our clients and to our prospects that it's just something new, certainly in the last 12 to 18 months, that they're seeing their AR continue to creep back up.
Yeah. Yeah. Casey, did you have anything else to add to this section before we jump on?
You know what? This is something I could go on ad nauseum about. So I'll say no, think yes, and we can move on to the next slide.
Okay, perfect. Um, Great. So the second headline finding that we have here is that denials have become a strategic financial concern. I think this is a perfect segue from the last slide. We've talked about denials and underpayments being a massive obstacle to revenue growth. You can see here 66% of survey respondents identified automated denial follow-up and resolution as something that's very important for their AI strategy to tackle for RCM in 2025. But the one stat I really wanted to kick off here is this 36% number. So you can see more than a third of respondents are reporting that denials are now being discussed as a strategic concern at the executive level. So for RCM leaders who are on the line, who you guys have spoken to, who are thinking about combating denials with AI or new technology in 2026, how can they think about bringing executives into the conversation? Do you guys feel like executive teams are already bought in on the need for AI in this space, or when should they be thinking about looping them into the chat?
Yeah, so I'm, call it like the salesperson on the line, right? And so when we're working and speaking with revenue cycle leaders who want to bring in an Adonis solution, they typically have to run it up the ladder to the executive team, the CFO. The question always is, what's the ROI? What are we going to get out of this? The nice thing is it's a double-edged sword. The nice thing is that CFO knows what the risk of inaction is because they are now seeing firsthand in a way that they probably didn't 2 or 3 years ago, the financial loss to the organization from denials. Denials have moved on from being this sort of like administrative headache that revenue cycle teams managed in a silo. Like, yes, you'd have to resubmit claims. Yes, you'd have to do some follow-up. It's annoying. It's hard to staff against, but like ultimately, you're going to stay in that 5 to 8% first pass denial rate, and you're going to recoup like 60% of that. That's not the case anymore. So the first pass denial rate kind of nationally, consistently, we see it in the survey, we see it in our own data. That's going up much, much higher than it's been in years past. And then the complexity around those denials, the level of effort and work it takes to overturn them has also increased. We hear that more anecdotally. It's more of like a qualitative data point. But what that leads to downstream is fewer dollars, right? It's more of these claims that you just cannot get to. It's not cost effective to staff human labor against it. There's not enough time in the day. There's better things that folks on rev cycle teams can be doing. And so these lead to, in sort of like a snowball effect, or death by 1,000 paper cuts, like whatever analogy you want to use, these lead to write-offs at the end of the year. And so CFOs are seeing that 1-2% of their net collections ratio that's just like always out of reach. And so, Adonis or really any AI solution that's like able to help you put a dent in that, they know basically what they're trying to measure against, and it's that reduction in bad debt write-offs, and that improvement in net collection ratio. And so, that's sort of the viewpoint I've seen on like executive level concern and awareness around denials, is just like it's become a lot more painful financially, and you can't look away.
Yeah, you can't look away. I mean, in terms of like strategic financial concern, I think to Casey's point, it's historically it's been 1 to 2%. Now, Caroline, it's like anywhere from like 2 to 4% um, of their denials and their aged AR that they're seeing fall into this terminal denial bucket of write-offs. We've been really focused on that. I mean, we're looking at certainly where cash is slowing down. So what can we do to accelerate that cash, and then what can we do to capture those dollars that have been written off to timely filing limits or written off because of downcoding or claims that have been underpaid, and capture some of those, recapture some of those dollars for our practices.
Yeah.
Yeah, I think the efficiency piece there too is like
Hmm.
a really important part of the story. And so, when you think about rev cycle organizations, they've been hard to staff towards really since 2020. It's hard to get the right folks in seat to do this work effectively, and like the volume of work has sort of crept up. And it seems like the payers know that. They know that provider groups and rev cycle teams are facing that challenge. And so, there seems to be this like interesting coincidence that of those claims that need rework and need follow-up, so the underpayments, the denials, the no pay, the no response claims, a lot of times like the net sort of benefit or like the cost variable, so the amount denied or the amount underpaid, um, on an individual claim kind of basis, it doesn't necessarily equate out to the level of effort it would take to pursue it. And I think that's why folks have to walk away from it, right? Like you'll spend a lot of time identifying your underpayments, and then you'll find, okay, well, it's $20 per claim and it's going to cost me $50 to go work it. Like, I guess I have to walk away from that. I think what's exciting about Adonis, our AI agents in particular, AI generally, is the ability to like put that revenue back on the table, right? If you have AI agents that can one identify these downcoding and underpayment episodes in real time without needing to employ analytics teams, business analysts, things like that. But then also have those AI agents like begin the process of pursuing those claims, doing some of the research on why you're underpaid, why you're denied, why you're downcoded, teeing up maybe an appeal letter, taking over like a lot of those manual processes. So then a member of a revenue cycle team, an AR rep, can step in and with like a quarter or sometimes a tenth of the effort of it would have taken without AI, actually handle that follow-up task and get that claim re-adjudicated and get the dollars back in the door.
And I think that's why we're finding, Casey, right? That's why we're seeing so many of the groups that we're talking with have as one of their strategic objectives revenue integrity. So it's utilizing solutions like ours to identify these scenarios, not necessarily working them one at a time, but rather assigning that entire event of being underpaid or contract compliance not being adhered to maybe your managed care contracting team. That we finally have the tools available to us to surface these instances of underpayment in real time. We can hand them off to that managed care contracting team and address them in aggregate.
Yeah, grabbing insights instead of just like playing
Yeah,
whack-a-mole claim by claim.
one at a time.
Yeah, it's interesting too. You'll see like with prospective clients, then partners of ours after they've been using the solution. Like it's interesting what the sort of like macro root cause is, for some of these underpayment issues in particular. Right, you'll find that like the payer in their adjudication software has a fee schedule from like 8 years ago that they were referencing, or they'll have an incorrect taxonomy code or an old sort of like specialty assigned to a particular provider. If you want to assume less than positive intent, you could say it's weaponized incompetence. But being able to, like, yes, from an AI agent standpoint, like work all of these one by one and really like, keep those dollars in play, but then also having a solution like Adonis Intelligence, where it's like rolling up these global insights, and saying, hey, for this particular payer, for this particular provider, we're seeing XYZ, and sort of getting to a much more holistic root cause. It's always interesting to see like what's under the hood on the other side of the table.
Yeah, definitely agree. Do you guys have anything else on this slide before we move to the next headline finding? Okay. Great. So last but not least, our third and final headline finding here is that reactive RCM comes at both a high operational and financial cost. So you can see here the percentage of revenue that's at risk or loss due to denials, underpayments, or timely filing limits. We also have some stats around how lack of real-time visibility into payer performance is impacting an ability to grow and collect revenue. Also, just about 50% of respondents identified central visibility across the revenue cycle as something that would be very important to have in 2026. To kick it off, we talk a lot about this idea of reactive versus proactive RCM. Michelle or Casey, could you guys just walk us through what the difference there looks like and maybe what an example of a proactive RCM strategy would look like?
Yeah, it's funny. I was just maybe a week or two ago at an Oregon HFMA event, and this was like the theme of one of the discussions there. How do you move to proactive, rev cycle posture as an organization? And I would say, like, maybe for comparison, Caroline, to answer your question of what reactive rev cycle is, it's sort of the like month-end reporting structure of years past, right? Where you sort of wait for your books to close on the month. You take a look at how you did compared to months prior, year over year. You see there's a spike in denials or a bump in my AR over 60 or 90 days, and you do some like root cause analysis, and you kind of come to your aha moment that like, oh, this payer now requires a modifier for these types of claims and a prior auth for these, and that's why I saw these denials. The issue is like figuring that out takes a lot of time, right? So one, you've already like waited for month end. You needed to have such a high enough volume of these issues to bubble up that you even see it in your data that to then go do your root cause analysis. So at this point, you're like 4 to 8 weeks out from the onset of this issue or this payer behavior change anyway. And so like there are certainly going to be within that mountain of issue claims that have piled up, claims that are going to be kind of hitting up against timely filing, claims you can't rework, claims that become write-offs. And as you're sort of working to this solution to like these issues that began again 4 to 8 weeks ago, the next batch of issues is cropping up for you to figure out later on down the road. And so in a proactive revenue cycle world, folks are one, like looking at data much more frequently, but they're looking at data more so through the lens of like what's happening in sort of minor ways in terms of my sort of claim behavior changing, other than like looking at your top line KPIs. So am I seeing an increase in no pay, no response claims for a particular payer? Am I seeing sort of like a denial anomaly? So something that's really interesting. We worked with a client a couple weeks ago. We were talking about they noticed a spike in denials for lack of prior authorizations just for one particular payer, one particular plan. So it's not that they like had stopped doing prior auths or forgotten to do a prior auth. It's that the sort of claim syntax where they were supposed to denote that prior auth number on the initial claim had changed and they weren't aware of that. So it's basically noticing these little issues that can allow you to course correct quickly and sort of stay, if not like in lockstep with your payer, just one step behind instead of 20 steps behind. And so it takes a lot more speed of data, but then also like richness of data. And I'll make the plug for Adonis Intelligence there. That's really what that's like designed to do, is to say, hey, something very much outside of the norm for your historic sort of data patterns has happened here. Let's not wait for this to become a mountain of claims to rework. Like, let's do this root cause analysis now and get ahead of the curve. So any claim that's been impacted to date, like, yes, is still sort of within the window of being able to be resolved. And we're also fixing this and getting proactive on a solution before it becomes this mounting problem. So that's my monologue, and I'm going to pause there for Michelle.
Yeah, that was awesome. Yeah, I mean, the transition from going from being reactive to a proactive organization for me, it's everything that Casey just said, and recognizing that the changes that need to be made aren't just in the work that needs to be done isn't just with the business office. It actually resides with the entire organization. So being able to use, I mean, to Casey's point, being able to use a product like Adonis Intelligence where I can observe that net new behavior from the payer. They've introduced a new edit, and I have a mechanism to actually alert the entire organization to this change. So whether I need to let my coding team know that there's been a change, or I need to alert my front end operations that there's been a change in the way, we register a particular type of patient, or in the case of the group where the prior authorizations just failed to appear in the appropriate utilizing the appropriate syntax on the claim form. Do I need to adjust my claim submissions, or do I need to plug in a solution to actually gather that prior authorization? That's really, I think that's an important consideration going into 2026. I think these business offices, we've let them shoulder the burden of the denials and work the denials and create the new rules and try and deal with all of the churn from the payers. I think going forward, what we all need to recognize is um, we need to identify the net new changes from the payer, the anomalous behavior in real time or as close to real time as possible, and then we need to alert the entire operation what has changed and how it impacts their area of the practice. So that really for me is that's the mindset change going from reactive to proactive is recognizing like I need to get this information out and it can't just exist in my AR in my practice management system.
Yeah, it can't just be a plan for like how am I going to work these
Yeah.
denials when they start rolling in, because that sort of leaves like no accountability elsewhere in the organization, right? If you have an eligibility issue or we're not collecting, correct demographic information or, patient responsibility, coding patterns, documentation, yeah, a lot of this stuff starts much further up in the organization. By the time your poor billers have it, like there's sort of too much that's already been done.
Yeah, 100%. And this is the last headline finding we were going to dive into today. But before we wrapped up, Casey, Michelle, were there any last like strategic pieces of advice or tidbits or anything you wanted to share with the folks on the line before we wrap up today's webinar?
Now, I would say my big takeaway and what was sort of helpful in just like reviewing this research and the survey responses over the past couple of weeks is that like none of these issues in a vacuum are big surprises, right? These are things that have been like bubbling up and been pain points and challenges for years. But they really seem to have reached a head and they're all sort of like converging upon one another, right? So organizations have had staffing challenges for years. Yes, like we know that that's been like the complaint of rev cycle leaders for a long time, but now it's really coming with significant sort of financial risks because you don't have the people there to work this ever sort of expanding, both in like volume and complexity, bucket of denied claims, underpayments, downcoding episodes. So you have sort of like this operational strain meeting up against the pressure coming in from payers, and it's sort of creating this untenable situation that like yes, there's definitely a way out of, but you can't rely on the same systems and processes that you've had in years past to address it, right? We've got to move past like the example I cited previously of like just your month-end reporting or just your work queues in a particular system to like triage issues. You really have to be able to get to the root of things, get ahead of these issues, be a little bit more proactive, and obviously ultimately like drive better financial results.
All of those things, and I would add to it, I think that a goal for all of us needs to be, irrespective of the solution that you're using, I think that we need to hold ourselves to being able to resolve and detect any of these issues near time, if not real time. I think we need to, I do think if anything comes out of 2026, it is going to be that we are able to move away from the month end and the quarterly and the year end reporting and recognize that in order for us to just given the volumes of denials and underpayments and downcoded claims, given the transaction volumes that we're dealing with, that we need to move as an industry into a near time, real time recognition of an issue and be able to resolve it in near time, real time. So I think I mean, for me, when I look across, the three headlines that we've presented today, it really it's our ability to focus people on the problems as they're introduced, be able to address them as they're introduced. That's going to be most important to driving down bad debt and this revenue leakage that we're seeing reported here in this slide.
Well said, both of you. Thank you so much for everyone who joined us today. Thank you, Casey. Thank you, Michelle, for your time, for sharing your insights and your experience with us. For everyone on the line, we will be following up right after this with a copy of the full research report with the recording of today's session. So if there's anything you want to dive into deeper, you'll have access to all of that. I know we're just about at time, so we didn't have time to answer any questions that came through today, but we'll be following up directly with any of you that sent in questions through the chat. And if you'd like to continue the conversation or you have any further questions for Casey, Michelle, or myself, feel free to reach out to any of us. You can find us all on LinkedIn or you can email me. It's just caroline@adonis.io. I'll facilitate any intros there. But thank you all so much again for joining and hope everyone has a great afternoon. Bye.
Thank you.